Good afternoon, everybody. Welcome to Dental Voice on the Case with Cyrus. My name is Rolando Mia. The purpose of Dental Voice on the Case is to hear from clinicians about issues that they're facing on a day-to-day basis, cases that they're dealing with, as well as how they're managing their practice. Today, we have a very old friend, good friend, Dr. Bruce Parker, with Bruce Parker, DMD, in Pittsburgh, Pennsylvania. Now, Dr. Parker is an incredibly seasoned professional. He's been in practice almost 40 years. He is a general restorative, understands technologies, cosmetic dentistry, all sorts of things, and absolutely very knowledgeable. What's especially important, and what we're going to listen to him about today, is this. Even through COVID, he continues to deliver, perform, and drive his practice. So we're going to spend some time to hear how you do that. Good afternoon, Dr. Parker, Dr. Bruce. First of all, thank you so much for joining us.
Bruce is fine, Ro.
Okay. Yes, Dr. Bruce. I've only known you forever, and
Forever is correct.
So how are you, sir? How are things going so far?
Things are great. Beautiful day here in the Berg. That's short for Pittsburgh. Hit some golf balls and after doing a big case this morning. So life is good.
Oh, fantastic. So I'm really interested to hear, because in a post-COVID environment, what you shared with me before is that you continue to thrive in your practice. And what I think what's important for our viewers to hear is, how do you do that? What are some of the tips? What's some of the advice that you would give people, and things that they should be thinking about?
As we've talked a number of times over the years, there's several factors that I've incorporated philosophically into the practice to make things work. Technology is one, team, and certain procedures. We need to make choices in terms of what business model we want to follow. One of the practice management courses I went 2 years ago we referred to dentistry as to retail. Where in the retail world, you have Walmart, and before that Kmart at the bottom, maybe Kohl's and Penny's. Above that would be Macy's, and then your Neiman Marcus's, Bloomingdale's, Nordstrom's. And I think we need to stratify where we want to be. I don't think most of us want to be considered Walmart. I mean, that's some of the retail chains, new grads. I don't have the stomach lining to cater to blue bloods, nor the temperament. But I want to do quality dentistry in a productive manner that fits my personality and my teams and the patient base. So I've kind of stratified myself as a Macy's, where more upscale, but yet accessible to everybody.
Wow. So wait, hold on. Before you move on. So this is the first that we've heard this. In defining what your practice is going to be, there are different levels, and it totally makes sense. And basically what you're saying is figure out which one you want to be based on what you personally are willing to do. Is that what you said?
Yeah, absolutely. Like Rye Spoor, who I've taken courses from, I believe he's in Seattle. He'll see one patient all day. They'll drink wine together, schmooze. I can't do that. I like to be busy, productive. If I have a long appointment, I'll do it like on a Friday when we don't normally see patients. But on a routine basis, I can't cater to that type of clientele. It's not my personality.
Wow. And how does your team fit into the kind of the mix of this entire process?
Great question. As you know, you bumped into me, scared me in Vegas last week at Serena World.
Yes, I did.
As you did that, I found out Monday morning my team decided a new team member was going to be fired by noon if she did not improve on Monday. She fortunately decided it wasn't for her. but they had a team meeting, and we want to be team led. I've used 3 or 4 consulting groups over the years. The one that fits me by far, my personality and patience, is Mike Kessner's group, Dallas. And it was his philosophy a lot different. It's team driven, team led, and my team now is a great bunch of smart people. One's a dentist, two should be dentists. The dentist is foreign trained, but they're all smart people, all advanced degrees, and they're leading the team. I'm just a coach sometimes, hopefully.
Wait a minute. So your team made the decision to transition or speak directly to one of your team members without you, and then informed you. Wow. How did that make you feel?
Wonderful. They've been empowered. That's what we want. What I do best is dentistry. My skill set, my people skill set is in the room of self-improvement. I can do dentistry. I'm not the best communicator in the world. I know that, and I can come across very poorly at times to people, very dogmatic, harsh. So the more the team leads, the happier we all are. And it continued all week because we had 2 other new team members that were not the right fit. This economy, the marketplace is very dry in terms of people looking for work. Every industry. Went for breakfast today. The restaurant was closed when they were supposed to be open. They didn't have a server. And same thing in dentistry. You and I had talked recently about how we finding team members.
Right.
Mike Kessner from Quantum Leap is his practice managing division. Hey, the coaches I had said, you need to go fishing. Always have a line in the water. Try and get the right team member. And that's what we've been doing. And I've had some really good catches in the last 6 months. Some new team members. One I knew from 40 years ago when she was a student in youth group. My clinic lead, who's just Boston, she got a pay raise before she got her first check. She's a dentist that trained in Panama. She's from Venezuela. I told Andrea, that's her name. She was my second daughter now, and it's all great.
So it's amazing with the lack of teammates available here. Your office is not fearful of transitioning people that don't fit. That's kind of crazy because what was it? A majority of the practices right now are struggling to find dental assistants, hygienists, that type of thing. And here you are, your team is making a very bold decision to say, hey, this isn't working out, move on and go find. That's very different in this environment. How is that affecting your business?
We are close to get back to pre-pandemic numbers in production.
Wow.
I looked in September for the year from comparing 2019 to 2021, and we were down about 10% from 2019. I think August and September are probably at the pre-pandemic numbers. So it's a work in progress. And, we definitely, a big dilemma I have is, do I want more team? I do want, because I thrive on being busy and productive. Do I want more team members or less patients? And mentally, I feel much happier when I'm busy. And there's ways that we've created a ability to increase busyness utilizing team and technology.
And what are some of those ways, if you would?
I knew you were going to ask that question. Pennsylvania permits EFTAs. So I've had EFTAs where they can place restorations and do other things, but primarily place fillings. where I can be more productive doing that than more traditionally productive procedures like crown and bridge. They, after there's a trained well, they can do it as well as I or better than I can. When I was in school, the Philadelphia Health Department, this goes back more than a couple of years, did a study before there were EFTAs, and the dental assistants that were placing fillings did that better than the dentist doing it. I candidly tell people I'm the last person you want me to do clean your teeth. Last prophy I did was on my sister about 25 years ago because I had to. I pitied her every moment of it. I don't do prophies. I can't afford to. I lose money if I would do cleanings.
What do you mean you'll lose money if you do cleanings? I mean, there are a lot of dentists out there who do their own hygiene. What
There
do you
are.
mean?
I don't understand it. I work with two periodontists. They do their own period maintenance hygiene visits. Overhead is much more than the fees for an hourly basis that I would collect if I did the cleanings myself. Even if I did 2 or 3 an hour, which would be difficult, my overhead costs of rent, supplies, phone, staff, etc., is significantly higher.
Wow. So the way you structure, the way you operate in your practice is, and you mentioned it earlier during our discussion, there are procedures that only you or a dentist can do. You
Correct.
focus on those. And then the other ones, like your extended function dental assistants, you have them do that. It seems like they enjoy it. Your patients get an excellent result, and you're able to focus on what brings in, or what only you as a dentist
Right.
can provide.
Exactly. And we utilize a lot of technology in my practice, which will, to quote Dr. Christensen, do it quicker, better, and cheaper. Do it.
What are some of those technologies that you use?
I've digital radiographs. You have had cone beam CBCT for about 12 years and able to see things diagnosed much better, pick up infections, anomalies, well, which you would never see otherwise, including my granddaughter, my oldest granddaughter. We did a routine cone beam, and she had an undeveloped sinus that required surgery. Could never know it otherwise. We isolate, which that story with me is funny because when I saw it when it first came out, Isolite 1, it was a cumbersome setup a little bit with fiber optics. And I jumped on buying the system. It was $1,300. I put the money down like that. And then I never used it because I was being too frugal for the mouthpiece for a couple bucks. Now I've realized I can do it quicker and better. Same thing with staff. So I personally have used Isolite on almost every patient for a good number, half dozen years or better, and maybe more. And since the pandemic, that is one of the mitigating things we've used with every patient, including hygiene. Where if they're using a Cavitron, reducing that aerosol is just protecting everybody. And the Isolite does a great job at that.
Well, thank you. Do you have CEREC or digital in your
We
practice?
have digital, CERAC, 3D printing. Excuse me, I have to sneeze. I'm apologizing.
Oh, okay.
Excuse me.
Bless you.
Thank you. You know, I have every technology except hard tissue laser. And we utilize them all and able to do things better and quicker and better for the patient. You know, CERAC is one visit procedure, aligners, you know, which is profitable for the practice in the right case. Use aligners limitedly, and patients love the results. Hate traditional braces, so it's all a win-win.
So you've expanded beyond traditional, just general restorative
Yeah.
procedures. You've added aligners. You do, if I understand, cosmetic procedures.
Yep.
You're also, providing, basically enabling your entire team, it sounds like, to deliver. For practices that are struggling right now, what advice would you give them with regard to overcoming kind of this, post-pandemic environment that dentistry is in right now?
I think we need to think outside the traditional box. There are things, and certain things in my life and practice are all moments. 9/11 to being able sort of negative. I was doing a root canal. I can tell you what tooth and who the patient was when that all happened. But I can tell you, I took an oral surgeon out to lunch 20 some years ago. I invited and said, Jimmy, I don't want you to hear this secondhand. We're very good friends. But I'm going to start placing implants. And he jumped back and said, you can't do that. That's my territory. They're teaching dental students to place implants. It's not the most difficult thing, and particularly utilizing guided surgery with cone beam and CEREC. My wife, who is technically in the kindergarten realm and hates blood, she could do it. Because we do it guided, there's no stitches, no bleeding. It's predictable, safe, etc. So, I think people need to get more continuing education, expand their horizons from when they were in school. Most of the things I do, I was taught in school, didn't work. Implants didn't work. White fillings don't work. CEREC was never even thought of. Cone beams weren't thought of. And we need to grow and realize that one constant in life is change. And if you don't change, you're going to be left behind.
Right. I so appreciate the context. What I've noticed, and I've known you for a long time, you know who you are and you know who you're not. And it sounds like having the perspective of recognizing that is huge, because you've also, it sounds like you reach out to, Quantum Leap to get help where you need it. And then you're embracing the education, you're embracing the change that you're seeing that's happening here, you're embracing technology. Yep. I love how implicitly you trust your team. And all joking aside, guided surgery, you still have to be a doctor to do it, and I love
course,
that. But it's if you
it's getting that skill set. And as you know, his son is an endodontist, and when he was in dental school, I told him he wasn't sure where he was going to go to dental school. And I said, get a piece of paper and basically pull a Norman Vincent Peale who says, make 2 columns, the pros and the cons. And that's what I had him do to make a decision where he should go to school. He went to the University of Pittsburgh, which was where I thought he should go. But I did tell him, if you go there, you need to do a residency afterwards, because I knew the training was insufficient. The number of crowns they had to do kept getting reduced to almost nothing today. And he's never cut a tooth on a child in his life.
Oh, my goodness.
He graduated dental school without doing one prep on a child in pedo. He graduated from pedo with enough points by doing cleanings and exams. And that's the same thing with dentures. Fortunately, he listens to me. It still does. And he's an excellent endodontist. And I don't like to tell him that because, as his father,
we won't say anything, okay?
Harass him a little bit now and then. But he has done endos where there's 5 and 6 roots. Stuff that just blows my mind. But he's, has educated himself. He's one of about 6 or 7 board certified endodontists in Western Pennsylvania. And it makes me proud, but don't tell him.
Okay. We won't say anything. First of all, Dr. Parker, I love the perspective that you have. Change is the only thing, and you need to adjust with that. As a way to, if I were to ask you to kind of bring this together and then, leave a key message to other clinicians out there who are listening, to your patients and your community, what message would you like to get out to them?
I think embrace technology, not for technology itself, but for what it can do better And as it says, Dr. Christensen says, if you can do it quicker and better and cheaper, do it. That means delegating to staff where you can delegate, utilize things, whether it's Isolite, Cerac. I can do a crown in maybe 15 or 20 minutes of my time.
Wow.
Start to completion, that including preparation. I mean, in Pennsylvania, our hygienists can give anesthetic. So if I need them, if they're available and can anesthetize a patient, that saves 2 or 3 minutes of my time. We use buffer sodium bicarbonate in our anesthesia, which adds a cost. But on the flip side, the onset of anesthesia is much quicker, more predictable, less painful. It's a win.
Yeah.
So if I can walk in, prep a tooth, prep a crown, and leave it to the team, then everyone's better off. And the thing to the patient with that is we're able to control our costs. So we can have lower fees and able to participate in insurance programs where otherwise you may not be able to.
While, if I understand correctly, still giving you the ability to work on, I think you shared with me that you had recently, 10-unit case or just these huge cases. So you're able to kind of straddle the gamut of what your patients need.
Yesterday we put in, I think, 28 units of crown and bridge, with 3 of which were implant supported.
Wow. Right on. Well, first of all, I always appreciate every time I have an opportunity to see you. You're right. There's a wonderful directness to you, and people know where they stand with you. And I know that, and you don't kind of beat around the bush, and I suspect you're the same way with your patients.
Sometimes I should.
I love how you work with your team. I love how much you trust them and the kind of the authority that they have, that you've empowered, enabled them.
They have to be empowered. And it's part of that's training, part's trust. People make mistakes. We all make mistakes. Yesterday in that big case, I put in 2 crowns backwards.
Huh. Oops.
Don't say oops. But we got it fixed. I was able to get it in perfectly without saying oops. I may have said a word or 2 under my breath other than oops. But the 7 words you can't say on TV, I hear.
Yeah.
Yeah, George Carlin.
That's right. No, we're not going to say that.
We're not going there.
Well, first of all, Dr. Bruce Parker, thank you so much. If our viewers want to ask you questions or they'd like to visit you, what would be the best way to get in touch with you?
Probably the best contact's the office website, which is bruceparkeroffice@gmail.com. Certainly can leave a message on the phone. It's 412-422-5959. And our website is bruceparkerdmd.com. And we are in the process, it's a slow process, of upgrading and changing it. At the meeting we were at last week, we just are in the process of doing forms electronically now. So that will hopefully be on the website.
All about safety, all about efficiency.
Confidentiality, HIPAA compliance, OSHA compliance, all the good stuff that keeps everyone safe and happy.
Awesome. Well, first of all, thank you so much for taking the time to spend with us. It's always a pleasure to spend time with you. I did see Dr. Bruce Parker at DS World this last week. He had sent me an email saying, "Are you going to be here?" And I took a picture of him and I sent him the text going, "Yeah." And he said, "Where are you?" "Right beside you."
I don't know how you found me that way.
I got a tracker, I can see. But
my wife didn't put a GPS on me, I hope.
I won't tell you I did that. But
gotcha.
Thank you for joining us. Thank you so much for taking the time. Hey, folks, if you like this content, please share it. If you have questions or would like to check out Dr. Bruce Parker's practice, please visit his website or send him an email. Dr. Parker, thank you so much for joining us on Dental Voice.
Rolando, excuse me my rudeness, which I'm famous for at times. I will be happy to talk to anybody. I was at a golf lesson on Sunday, and the student after me is a urologist. His daughter's in dental school. I said, have her call me. Let me help her.
Right.
I love doing that. I love teaching, particularly when the minds and these young down students are sponges.
Yeah.
I mean, it's scary what they know, do, and how they learn. And to be a part of that, I tremendously enjoy it.
Awesome. Well, thank you so much. Have a wonderful, safe, and restful rest of your weekend. At some point in the future, would you like to join us back here and
I'd
kind of
love
share what
to.
else you're doing? Awesome.
I would love to.
Well, please thank you for taking the time. Please say hi to
And
your.
may I give one more pearl that I gave to
Yes.
you?
Yeah,
I
absolutely.
think beginning of the week. As I said, I've used Isolite for I don't know how many years it's been out. Probably 15, I bet.
Yeah, 20.
20. I don't know. I bought it as soon as it came out. I saw it at Chicago Midwinter. I was struggling with clogging of and I may have the part's name wrong. The tube thing with
the control head. Yeah, yeah.
the control thing, and I called support and they said, run hot water through it. Didn't help. I had brain passage of gas through my brain. And I realized the brain part was to take my steamer that I use for the CERAC and blow that through the line, and it opened it up perfectly.
Excellent.
So there's pros for everything. And all you have to do is just ask and learn.
Excellent. Well, thank you so much for joining, and thank you for
My
that.
pleasure. Thank you for inviting.
Have a great time. It's always a pleasure seeing you, and I'm sure we'll talk soon.
We will. Take care.
All right. Thank you.
Bye.
Bye-bye.